Hi everyone, Steve Steves here, coming to you from the Nutrition and Health Center in Houston, Texas, where we provide hope for healing and healthy solutions for abundant living. Today I want to talk to you a little bit about food and chemical, environmental sensitivities, allergies, how your immune system is responding to your environment. When I moved to Houston in 1980, I was only 21 years old, hadn't really had any problems with my health that I knew of significantly, other than having a football injury and being sick as a kid off and on with things. But I experienced extreme allergy response within 2 weeks of living here in January 1980. And I was wondering, what's going on with my body? Why am my nose is running, my head is hurting, my sinuses were constantly giving pain and discomfort. And so I started going to doctors and started down that pathway and that routine of take an antibiotic, weaken the immune system, get sick again, take another antibiotic. So that routine didn't work for me for very long before I wised up and said, I've got to do something different. Within a few years after getting married in 1982, and I was diagnosed and sick in 1983, when I was told I was going to be in a wheelchair the rest of my life, and I needed to make some kind of a difference because of ankylosing spondylosis as a diagnosis. So the tying in of taking medications for all those years for different things, headaches or antibiotics for sicknesses off and on, is the typical routine for Americans. When we take a closer look at our each individual history, we've got to ask ourselves, well, how many antibiotics have I taken in my life? What has it done to my digestive system, to my liver? How can I analyze the function of the body and improve function? We have various different types of tests. The ELISA test, where we measure lymphocyte response to your sensitivity to various foods, chemicals, heavy metals, environmental toxins. You want to know that, and I would encourage you to contact our office for that. Also, we can look at a picture of the blood and find out exactly what's going on within the immune system via dark field, or also comprehensive blood and doing detailed blood analysis. And really encourage also neurotransmitter testing to see how your nervous system is responding, because environmental components do trigger, for example, histamines and elevations in excitatory neurotransmitters, and can deplete your calming neurotransmitters, as neurotransmitter tests have valuable information with all types of dysfunction, because your nervous system is tied to every part of the body, including the immune system. Our ears, nose, and throat, our lungs, our digestive tract. The digestive tract has 2/3 of the immune system within it, and so what we're putting in there obviously is going to interpret or affect and reflect as to what's going on in the rest of the body. That secondary immunity, which we don't need to inject anything into, is already designed to pick up the signals that come in from the mucous membranes in your nose, your mouth, your digestive tract. It doesn't need to have anything forced into the bloodstream to think that that is the greatest wisdom that was ever created to allow the body to reverse and heal disease. The body's designed to do that. You're created in God's image. Jehovah Rapha made you to heal when you cut yourself, when you break a bone, whether you damage mucosal lining or whether I damage my joint tissue and my liver from taking meds for those years. My body has healed itself, and now at 59, going to be 60 this year, which is halfway home. I'm excited for what the future holds, but I do take a lot of protocols. I do use echinacea every day, which is an immune enhancer, immune balancer. It helps with autoimmune conditions. It helps improve white blood cell activity. I use a formula called Bronch Effect, which I make a tea with, and it's delicious this time of year in the spring, where we need that support for bronchial breathing. Also use a formula called Potent Sea Guard, which I love because of its support for white blood cell activity and the type of vitamin C. It comes from a potato that's in a secret place that we can't get from the manufacturer because he doesn't want to reveal his sources. It's a pure source. It's non-citrus. It's non-corn. And the benefit there is the immune system then can enhance, repair, and feed the white blood cells, so activation and repair can take place. We use a formula called Sinus Forte from Standard Process, which is very beneficial in its balancing effect for sinuses. We have a special procedure that we utilize that by, that if you get set up on that particular formula, we'll tell you how to use that by sucking on the tablet and sipping water, and how to take that throughout the day. Ginger is especially effective to improve mucosal production of the mucous membranes, and globulin proteins or mucus production can be improved with ginger, making ginger tea every day or using some ginger oil. And then you have to determine if you're a candidate for something like andrographis, which helps the lungs, or to use Immuplex formula, which has some glandulars that strengthen different parts of the immune system, like your thymus gland, to allow its production for further aggressive white blood cells to destroy invading organisms. We use a lot of lozenges, like our zinc lozenge is very effective at clearing the mucous membranes in the throat. So we want to encourage all of these protocols. I utilize every single one of them. I keep them in a medicine chest that travels with me all the time, not just for myself, but for others. But you can contact our office and find out how you can get better in your immune system and overcome all these environmental sensitivities, because God does want to have you in a better place, that you too can be hope for healing and have the healthy solutions for your friends and family for the rest of your life. I thank you for watching.